Okay. So this breaking the this article is on breaking the HPV vaccine resistance and explainer for heartbreakers. Okay, so now remember that we are using our guidelines to check. So usually I start with the title to check whether the header com, comply with the guidelines. So okay. So now I've checked this and it's still showing me normal test instead of showing H1. So this is the title and it should show. So this is where you get it. You see, if you click this, you have normal text, you have title, you have subtitle, you have heading 1, heading 2, heading 3. So that title should be heading 1. Remember I said there is an SEO principle. So I've converted it to heading 1. Then I noticed that the plagiarism score, it was duplicate checker that was used for plagiarism score, which is okay. Because I recommended, the guideline recommended duplicate checker. But then the AI score, I don't know, I can't see this doesn't look like what I used to. I don't know whether this is detecting AI. I don't really know whether it's detecting AI because I can't see the title. Okay, but let's assume that that's what it is. So it's less than 40%, which is okay. Then we have the highlights. The guidelines recommended highlights, and this writer added it. So that's a good one. Although, as you can see with me, I don't know whether you can, let me increase it to 125%. As you can see with me, my Grammarly is highlighting a whole lot of things there. So that's why you should always have Grammarly. Although these are major errors, minor errors anyway. But you know, they say there's no second time to make a first impression. So you should make sure that these red lines don't appear on your work. I think my Grammarly has some problems. But anyway, it highlighted them as errors because of maybe more space. There's more space than it should be, that it should have. So you make sure you use Grammarly to correct all errors before submitting, because if the person you are submitting has Grammarly, then your own work will, there will be a problem with work. Now, I'm just looking at the structure, I've not looked at the content. Okay, then this is the introduction. I expect this to be heading 2, not heading 1. Okay, another thing I need to show, because sometimes some people don't know, whenever we review, we use this mode. On Google Docs, you have editing, suggesting, and viewing mode. So normal review we just suggesting mode, so that whatever I do here to show on the panel. So now this introduction is supposed to be heading 2. And that's exactly what I'm doing. So I've converted it to heading 2. So that correction is show here. Okay, so let's look at the article now. Now, when you are starting a patient education article, it's always good to start with something they can relate to. Not just defining it. You may start with a sentence, like if you look at my article on common vaginal infection, I started with a statement. I said, doctor, I have toilet infection. I know most Nigerian women, they will relate with that statement, although it's a very wrong statement, very wrong. So within the article, I now explain why it is not a toilet infection. But I use that to draw their attention. So if you can start with something that looks informal, something that will draw attention, because it's not a scientific article that you are writing. Then the the paragraph shouldn't be too long so as not to bore whoever. You know, the introduction is like an invitation into the article for people to read the article. And if they find it boring, they will bounce off. There's actually something they call bounce off rates from websites. They will just look at it and bounce off the website. So, and that means if you are writing for a particular website, they normally track articles. They will say, this very person, anytime this person submits an article, it reduces traffic to our website. So you have to be careful. So let's now look at the content. Here, like I said, that you have to prioritize bullet points. There is an important information that is hidden in this paragraph. And unless you look at it, in fact, I had to come back again before I was able to see it. You mentioned what HPV does. You can cause genital warts, you can do all these things. Then you mentioned that it can lead to cancers. So all these cancers, including cancer of the cervix, vagina, vulva, penis, anus, should have been listed as bullets, so that any non-medical person that comes will say, oh, so this HPV is this serious. And remember, you are trying to break their resistance. You are trying to break it. So it has to be convincing enough for them to say, oh, this thing I don't want to take. I'm going to go and take this vaccine if this is so. But then the information is sitting here that even me, I didn't see it initially. Then you should also explain in this kind of article how HPV actually leads to cancer. You just mentioned, you say within 1 to 2 years, the body's immune system clears out HPV on its own. Correct. Then in some cases, HPV infection causes genital warts that can be found on the vagina, penis, and in some rare cases, the truth. In other instances, HPV infection can lead to cancer of the cervix. What do you mean by other instances? So you should have been more specific. It's when you have persistent HPV infection that it now leads to problems. It causes changes in the cells that first of all, it will cause dysplasia first. Then from dysplasia now, it will cause metaplasia first. Then from metaplasia, it will cause dysplasia and now becomes cancer. So you should have used layman's language to say, okay, when this HPV stays in your body for so, it causes the cells in your cervix to change from one form to the other. Then over time, those cells will now get to a level that they will start outgrowing their boundaries and they will now form cancer. This is layman language. And another thing we should also take note of is that for those of us that reviewed articles over and over again, sometimes there's a way you look at an article and it will just be speaking AI to you, sort of. So that's why you should, even if you use AI to, although I don't like AI generated, I will show, if we have time, I will show us my article the way I usually start writing it. But even if, give it a human face, because most times AI has, I call it uniform. It normally has this uniform-like look. That when you look at something, you say, this thing looks like something I've seen somewhere. That's the way it normally looks. I'm not trying to say holistically that this was AI generated, but I think I saw some AI trademarks in it. Then we now go down here. I can see a whole lot of statistics. Now, I don't know what's wrong with this grammar. It's not showing me. But then it pointed this out because there's no comma. This is 20,000 should have a comma. That's why I pointed it out. But then whenever you mention statistics like this, where is this statistics from now? And I don't know whether it came from 1 to 3. But then 1 to 3 came after this last sentence. So I should assume that this 1 to 3 is referring to this last sentence. That means that this whole sentence doesn't have any reference to any hyperlink. So this kind of statistics should be hyperlinked. It should be hyperlinked so that, remember we talked about articles being reliable. That's part of the reliability. Then talking about HPV vaccines, I say that is the best way to prevent another HPV. These vaccines are safe as they do not contain the live virus. You know, when the whole HPV issue came, there were a lot of misconceptions. And that's one thing that this article is meant to break, to be able to convince people that yes, this thing does not kill. So this statement is a good one, trying to tell them that this thing doesn't kill, that just for that are not for treatment, rather than for prevention. But it will also be good to point out that receiving HPV vaccine is not the end of the road in the prevention of cervical cancer. So I expected to see that kind of statement because you know that it doesn't give 100% protection. So you still need to do screening and other things, lifestyle modification to completely prevent cancer, cervical cancer. So then another thing is that why age 9 to 14? That's what the question most men were asking, that why do you want to give these girls? They didn't understand why. Some people thought that it was planned by the government to make them sterile. So this kind of article should emphasize why that age 9 to 14 is important. And the reason is that you give it before the onset of sexual activity, which is very crucial. So this is the kind of information that this article should emphasize, so that when a woman looks at it, they will say, oh, no, is that the reason? I even thought they wanted to use it to wipe out the population of girls. So that's about that. Then I came here and saw there are 6 types of vaccine. I was actually shocked when I saw that. So I had to go to cross-check. And I found it on the WHO website. Now, this is new knowledge to some of us. So we used to know about 3 types: the bivalent, quadrivalent, and monovalent. So now, this kind of cyst should be hyperlinked straight to where you got it from. So that somebody, in fact, what I just did, I said, okay, let me go and check WHO first. Let me see what I'll see it there. If I don't see it, then I'll now find out where. But when I checked, I saw it on WHO, so I didn't bother again. So then, yes, this one is good. Anytime you are putting a schedule or a routine, this kind of routine, you should say who mentioned it, who said it, because there are so many bodies. You have ACOG, you have European, this and that, you have Australian. So you should be able to say who said. Then breaking the HPV. Okay, that's the topic. Then this subsection is HPV vaccine resistance in Africa. Now, cervical cancer is an African problem, as we know. So most of the problems are in Africa. And when this issue of HPV vaccine came up, there were so many studies. People were just, questionnaires were flying around everywhere, just like during COVID. Questionnaires were flying around. So currently there are so many studies on vaccine, HPV vaccine resistance in Africa. So I was expecting to see the Kunle et al., so and so in Oyo did a study and they found this. Emeka and so in Oka did a study and found this. So and so in Yola did a study and found this. This is an African problem. So it should have an African face, this article. I didn't really see it. I was seeing a lot of WHO. I know sometimes they pull information from everywhere, but then as far as some people here are concerned, they don't know what WHO is. They don't even like themselves, just like Trump doesn't like. So you should be able to say that somebody here said that this is it. So I expected to see some African, which I didn't really see. Then going down. So now, in this section, you mentioned vaccine hesitancy and some of the things that can lead to that. Fears about the safety, negative beliefs based on myths and misconceptions. So this section should be part of this. It should be under barriers to HPV vaccine resistance. So that should have been the introductory paragraph here. Then before you now start talking. Then I believe that what you have here is bullet points. I believe these are not, because there's nothing, you don't have one sentence paragraph. So then if these things, if there are bullet points, then there should be bullets on them. So what you should have done is to convert this to bullet point. And I forgot to mention that it appears this article was not originally written on, I don't know whether it's this one, on Google Docs, because I was seeing docs, something like this, like Microsoft Word, when I opened it, before it finally opened on Google Docs. So what you do is to bullet it, like I'm doing now. But you still have to do correct. Okay? So that's what it should be. It should be bullets. Bullet is bullet, sentence is sentence, they're not the same. So, and you can still see my Grammarly still pointing out something. So this one, instead of poor literacy, should be the poor literacy level. This one, the paucity of adolescent friendly, there should be a hyphen between adolescent and friendly. services. Then this reference, I don't know what the reference is for. Is it just for this last statement? Or is it for this whole thing? If it's for this whole thing, then that's where having an introductory statement helps. You write that introductory statement and put all the references there before you start writing. Then we expect that after talking about the barriers to HPV acceptance, that the measures to break the HPV resistance should address the barriers, all the barriers. So I was looking out for such, but I saw investing in education and improving awareness. That helps to fight misinformation and poor literacy level and optimal awareness of the importance of vaccine. But then here we can see paucity of adolescent-friendly services. So part of the way to combat that should be to have adolescent-friendly services. Then we can also see cost of the vaccine. So part of the way to address that should be to have cost as part of the solution. So the solution should always match the problem. And even in this kind of article, it's kind of article that it would be good to have a session on, you have meat, then you talk of fats. I think somebody did it in her own, meat and fats. You are directly combating those meats. But anyway, this is a very good attempt. One good thing is that the writer made efforts to abide by the guidelines, which is very important because usually that's where the problem starts. When you don't, you go off the guidelines. So what you need to do is to give this article an African face. This is an African problem. The references should have an African outlook. That's it. And we can also see that the person, okay, because we don't really have peer-reviewed articles there, it may be difficult to say whether it is Vancouver or not. Anyway, it looks a bit like Vancouver. But then this assessed, the day it's assessed usually comes before the web link. The web link is usually the last thing on the reference, not the assessed, usually the last thing. So just take note of the corrections. I don't know whether I missed anything. Yeah, I wrote some of them. Okay. I think I mentioned all the things I wrote down. So that's about that. So congratulations to the writer. Just make your corrections, then decide what to do with your article. Then let's look at the second one. So this is anemia in pregnancy. Something struck me immediately. I opened this article. Let me see whether Grammarly will work. You see, my Grammarly is misbehaving with some of these articles. And that's what it normally does. Once it's not, most times, once it's not originally Google does. Now it's not, okay, it's trying to come up. But anyway, what struck me was the anemia, the spelling of anemia in pregnancy. Remember our guidelines said UK English. Now, this is not UK English. And I don't know why this grammar refused to work. Because when I opened it in the evening, it's highlighted. I have a lot of American English in this article. And do you know what? American English is one of the markers of AI, of ChatGPT. Yeah, that's what it uses exclusively. So that's why you should be very careful with it. So most times, once I see American English glaring at me in an article all over, I'll be like, there's a problem. Because even Nigerian, English, we don't use American English, we use UK English. So I'll be wondering, this writer, where did this person get this from? As a Nigerian. So please, the guideline said UK English. So this writer failed in that aspect. Let's look at the format. This is normal text. It shouldn't be, it should be, it's supposed to be H1, heading 1. Then this highlight is too summarized. Anemia is common in pregnancy. How common? Iron deficiency, okay. Certain women at higher risk. It doesn't provide any information. Who are the certain women? Then early diagnosis and treatment are crucial. So Gives a little bit of information. But then your highlight should give some level of information, some level of specific. It's like an abstract. To the extent that somebody can actually look at the highlight and get some information about the article. So these highlights need to be improved. Then initially I was looking for the plagiarism store. Then I saw tab 2 here. So I had to go behind to check that. Then I saw AI detector by Grammarly. That's not part of the recommendation. To say using detecting AI. And I didn't actually see the store. I don't know. Yeah, I tried to move this to see whether I would see the store. I didn't see it. Then this plagiarism by duplicate checker 9%. That's okay. So make sure you always use the recommended software. Then this writer also didn't write the word count. I don't know whether the person wrote it behind. Let me check. So whether this is up to 1,200 or not, I will have to cross check myself. Okay, let's not bother about that. But just know that you're supposed to do that. So let's go into the article. Overview. This overview should be H2. This overview should be H2. It's still showing normal text. So the person didn't adhere to the guideline. It's supposed to be H2. So it's saying anemia is a condition where the red blood cells, which are the cells that transport, are low in number. It's a common condition that affects pregnant women. Having anemia during. Okay. But can you imagine starting with this article with something like, do you know why, as a pregnant woman, you are always looking for, I don't know what they call this, is it chalk? What's the English name now? Picker. That's what I'm trying to get. Like, what's the English name?
I don't
I
know
know
about the English name, but it's English I know.
we call it Nzu in Igbo. You can start it like that. Do you know why you always want to take this local chalk in pregnancy? That is because of anemia. There is a sign of iron deficiency anemia. So that's an inviting statement. That, in fact, there's no pregnant woman that will see that I will not want to check what you want to say. But then this one just started normally, just definition. And then even the definition didn't say what exactly anemia is scientifically. Is it below 27% or 30 or 33? I remember last year, one woman that didn't want the daughter to go for youth studies camp. She brought the daughter to the clinic and was saying that she write a medical report that the girl was anemic. So I asked her to give me the result because they were just coming from the lab. And I saw 33%. I thought that this girl is not anemic. She should go to the camp. She said, no, that she's having menorrhagia, that she's weak and pale. I told her, anyway, I've looked at her. She's not pale. I have the result. The result is good. So we're not writing any medical report. So no matter how much you talk of anemia, if you don't give it a figure, a pregnant woman may still be confused even when they have the results in their hands. So I expected that kind of figure to be here. Then I saw a statement here that I didn't understand. So we can see, we can see hemoglobin. This is American hemoglobin again. So that's suspicious. You can see during pregnancy, this statement, I didn't really understand. It said during pregnancy, your body needs more blood to support the growing baby. As a result, the amount of blood in your body increases by 20 to 30%, which increases the supply of iron and vitamins that the body needs to make hemoglobin. I didn't really get the meaning. We aim for clarity. So all your sentences should be clear enough. One thing we know about pregnancy is that the blood volume increases more than the red cells. And that's why you have a relative anemia in pregnancy. It's not a complete anemia, just that there's overdilution. So I think that's what this person was trying to point out. But I didn't get the message. And also, patients won't be able to, non-medical people won't be able to get the message. Then, what causes anemia during pregnancy? Now, there's something that I noticed in this article. I didn't see figures at all anyway. It's as if everything about statistics did not show up anywhere. Now the world is data driven. So even if you're writing to patients, there should be some data that must follow whatever you are. So that's not good enough. Then I didn't see any distribution in terms of epidemiology. But you shouldn't use the term epidemiology anymore. But you should be able to say that this anemia is more common in this part of the world than in this part of the world. Again, we didn't see that as well. Then when we went to causes, some things were obviously missing. Remember we said that medical writing articles should be comprehensive and that all the information that's supposed to be there should be there. If not, that means you are under-informing. This one is not misinformation. Now, when you talk of anemia and pregnancy, there are three things that may happen. Is either you have increased blood loss, or you have reduced production, or you have increased destruction of red blood cells. So everything that can cause any of these three things should be reflected. Okay. Now you talked of iron deficiency. That's it causes reduced production. Folate deficiency causes reduced production. But it's better to use folic acid than folate. You use the term that your audience they understand. Most pregnant women they know what folic acid means, but they don't know what folate is, even though they're the same thing. Vitamin B12 deficiency reduced production. Then you talked of blood loss. The only thing you discussed was blood loss during pregnancy. That's the one we can see. And what of occult blood loss due to hookworm infestation? That's one of the causes of iron deficiency anemia. What of the one due to schistosomiasis that can cause hematuria? It wasn't reflected here. Then what of the anemia due to hemolysis? Like you have a malaria and sickle cell disease, which is an African disease. You didn't reflect it here. So the information is not complete. You mentioned the one of chronic condition, that's good enough. So you need to be comprehensive enough in the information you have given. Then going down, you mentioned okay, who is at risk? Having to again, this should be bullet. This should be a bullet. Like I said, bullet point is bullet points, sentence is sentence. And that's why you should get used to Google Docs, get used to all these tabs. Know how to put a superscript on Google. I need to mention this one because it's somehow difficult. Know how to put a superscript on it. Know how to do some of these things because that's where the world is going. So this should be bullets. You should put this in bullet, although it's not comprehensive enough because I didn't see things like people with hemoglobinopathies and things of that nature. Then symptoms of anemia. I was looking out for the picture that most of us know. Again, I didn't see this, and as we can see, the American spelling continues to come up again. So the person didn't put this. At the same time, this is not also in bullet points at the same time. So you see, once you put it in bullet points, the look changes immediately. So it improves readability. Then going down, how is anemia diagnosed? I know there's no doctor that will see a patient and request for full blood count straight away. No. Diagnosis involves history, examination, investigation. So now we can only see straightforward investigation, and then the investigation is not complete. And it's not even the correct investigation anyway. What you need to diagnose anemia is either hemoglobin or PCV. But then, because anemia can be caused by a whole lot of things, you now need to do full blood count to look for WBC counts in case you have an infection. Then you have to look at the blood film to know the type of anemia. So I expected to see things like that. That's in folate deficiency, the red cells will look bigger than normal, or in vitamin B12 deficiency. In iron deficiency, they will look smaller than normal. You're now writing in bracket microcystic anemia. If it's chronic diseases, the red cells will have normal look. Then what of the other causes of anemia? You need to check the genotype. You need to screen for malaria. And you need to do stool MCS for hookworm and urine MCS for schistosomiasis. So again, this diagnosis is not complete. You didn't give the complete information. Then talking about treatment, you mentioned iron supplements. Okay, that is good. I didn't really read the contents of the paragraphs anyway to know. But I think mentioning the names of some of the ones that you know may help, like saying fesolate and things like that. Folate and B12 supplements. Then dietary changes. Okay, that's okay. Treating underlying. Now you mentioned underlying conditions, but in your diagnosis, you didn't make any effort to diagnose those conditions. Then blood transfusion. You should also remember that apart from oral iron, you can also use parenteral iron. So that should be an addition. So that somebody should not read your article and maybe she gets to the hospital and say, and doctor say, oh, we need to give you iron injection. And she say, no. The other day I read an article and I didn't see it. So it should be comprehensive enough. Then how to prevent anemia in pregnancy? Now, because you didn't capture all the causes of anemia in pregnancy, this place is empty. So you didn't talk about intermittent preventive therapy for malaria in pregnancy and things of that nature. You didn't talk about even premarital uh, counseling and genetic and genotype testing to prevent girls from having the sickle cell genotype. So you see, it's an all-encompassing thing. And most times prevention, you have primary, secondary, and tertiary prevention. So prevention should always take that shape. So the writer has done well, but there is a lot of room for improvement. Give the article a human face. Give it a regional face. This is a regional problem. So give it a regional face as well. Provide statistics to back up your claims. Then make it comprehensive. You have a lot of missing information in the articles. And I did not see any reference in terms of number anyway. I saw some references down, about 3. I didn't see any number up to show for that. And also the references, once again, they are foreign references for a regional, for an African disease. So this again is a problem. Whenever you are writing, ask yourself, this disease, what's the distribution? So, and your write-up should show that you know that these are the people that are most commonly affected by this. So please, for the writer, congratulations for submitting. You've done well. That's a bold step submitting, but then you need to do a whole lot of work to improve on the article. All right. Yeah, 5 minutes to 10. We have one remaining. So let's look at the last one. Then there is the secrets that I will show you. I hope I don't forget the secret. Okay, so this is on colon cancer. Why is screening important? Coincidentally, I did a video on colon cancer today. So I didn't know I was going to review this. So after I did the video that I saw this, I said, wow. Okay, so for this Grammarly for plagiarism. This looks like Grammarly. I can't see the title, but it looks like Grammarly. I know we didn't recommend Grammarly. Then this AI content analysis report, I don't know the software. So we didn't also recommend it. The person added word count. That is good. But you should try and use the recommended softwares. Then the person didn't add highlights. So that is wrong. The guidelines say you should add a highlight. Okay, so let's look at the introduction. Colon cancer is a type of cancer that affects the colon. It often begins as a small. Now, something happened along the line as I was reviewing this article. I saw some things that were looking similar. So I said, let me go and to ChatGPT and generate this article. And when I did that, I saw similar statements. You see, most times I'm an advocate of, if you tell the volunteer writers, sometimes we review an article more than 3 times, because once I see AI marker, then you have to go and do a lot of work to remove those markers. AI can write and it looks beautiful. You see it looking beautiful. But the problem with it is that another person can go there and generate the same thing. And it becomes a problem. If you go to Healthline, you say an article, the same language. If you go to Medline, you say an article, the same language. You go there, you say, then that means all of us are jokers. So it's not about whether the article looks good. It's the fact that that thing can be duplicated by so many persons. And that's why you should always try to be original. After writing, you can go to, in fact, what I do is that after writing, I told us in the first lecture, I put it on AI and give it a prompt. So a prompt, correct the grammar, correct the sentence flow, correct the syntax, do not rewrite. Please do not rewrite. Because if you don't write that, do not rewrite, what you see next will surprise you. So I just use it for correction, but you still see my language. You still see me in that writing. Because all these AI looking sentences, you won't see them. So please, it's not about whether your article looks good. It's the fact that it's a uniform. That's the best way to describe it. Anybody can generate that sentence. Okay, so let's continue. So what if you started this? Now I have a problem in my city. For those of us who live in Abuja, I stay in Gwarenpa. That most times in the evenings, as you are coming back, you just see a whole lot of joints. Or people waiting to buy suya, waiting to buy shawarma, waiting to buy this. What if you started this article like that? Starting it with one of those things they do that increases the risk. We know that red meat is one of the risks of colon cancer. So you can start it with that kind of statement. So now that statement will draw people to come and say, oh, red meat can cause cancer. There are some people that go to those joints every single day as they're coming back to work, and as long as they're concerned, they're living the life. So what if you bring it up in your opening statement? So that's how this article should have started. By bringing, if you look at my twin gestation article, I mentioned how they normally pray during weddings, that the woman should have not just one set, many sets of twins, without knowing that they're asking for problems. So you just bring it up. Some people may laugh over it, but they will still see the sense in what you're saying. So did I look at the, so this is heading 1, it should be heading 2. Because this is the introduction. Where is the title? The title is missing. The title should be heading 1. This one should be heading 2. Understanding colon cancer should be heading 2 as well. And then what is colon cancer should be heading 3. That's the way as you go down, the headings reduces. Okay. So I want to look at the things I wrote. I've mentioned that plagiarism checker, then no highlights. Headings are not uniform. Some are heading 1, some are heading 2. Then this is about screening. This topic is about screening. So that means that you have to convince whoever, like someone like me. I didn't know that colon cancer is something that people should be screening for. If not for the video I did, so I had to look at some of the details they sent to us. I was like, so you actually screen for colon cancer. So you should, that's what your article is about. Trying to convince people that this is why there should be screening for this article, for this cancer. You made an effort at trying to explain what it means and how cancers develop and how the cells overgrow. You also made an attempt to mention who is at risk, but you are not so specific. You say older age. I mean, what's the meaning of older age? What's the cutoff? So there should be a cutoff. Then somewhere down the line, there was a place you mentioned those who have average risk and those who have high risk. I had to come back to this section to find out whether you categorize your risk into average or high, and I didn't see. So that means that statement down did not correlate with what we have here. Because what do you mean by average risk? What do you mean by high risk? Then you talked about the symptoms. That's good. Um, at least in bullet points. Then this section on why screening is important is like the crux of the matter. I'm still to be convinced, even me, I'm yet to be convinced that people should routinely screen, apart from those who have family history. So this section should convince your readers on why they should be screened for colon cancer. And ideally, you should put those points in bullet points. Like I try to stand through to get the main points. I didn't really get much. So whatever it is, you have to outline the points so that people can look at it and be convinced. Screening for colon cancer is not like doing pap smear or doing mammography. This one is more serious because of the colonoscopy. So you need to convince people. Then down here you said recommended guidelines for screening. By who? WHO or American College or European College, or I don't know. So whenever you're talking about guidelines, you should mention the people, whoever that recommended. I remember when the information they gave us at Full Fridays, they said cutoff should be 50 years, and that was what I used for my video. Then I came and saw 45. I was like, oh, I don't even know which one is which again. But assuming you hyperlink this, it should have helped me to be able to confirm your source where you saw the 45, not 50. I promise to show us how to your data, the 45 years you used and some of these things we can't verify. We don't know where you got it. And all the information you mentioned about getting screened every 10 years, we don't know whether that's correct or not because you didn't convince us. So the article is not convincing enough because of the lack of references and hyperlinks. Okay, what screening methods are available and which one should you opt for? Okay, you answered the question of the screening methods that are available, but you didn't answer the question of which one you should opt for. So if I were you, I will remove this part, the one you should opt for, because you didn't answer that question. So, and it may be good also to start with the less invasive ones, like the upper blood test should come first before colonoscopy and the other ones. Okay, so I actually like this where you try to debunk the myths and misconceptions about colon cancer screening. That's good. That's a good one. Then I didn't see any conclusion. We just saw taking action. And meanwhile, there are some statements that are AI-ish. Let me use this word. Taking action is one of them. So even if you wrote it yourself, it should still look like it was. So some people have started avoiding some of those statements just to play safe. So there should be a conclusion. You didn't conclude this. I don't know whether this was supposed to be the conclusion. Maybe you didn't put it. I think so. You didn't put the subheading. So please, and again, we didn't see any numbers. You didn't put in test citations. And that's one of the reasons why we're having problems being convinced about some of the figures you quoted. Then I came down here and I don't know what I saw here. I saw some of these things. I don't know whether they're part of the references because I can't understand the formatting. The formatting. Then I now saw four others below them. I can't really say what the writer did here anyway. But then your references should be Vancouver. I think some of them are Vancouver here. Your references should be Vancouver. Then you should have in-test citations. So you did well, but you still have a lot of work to do. Just like I said for the other articles, these things should be human. You should bring them home so that human beings can actually be able to look at it and say, this looks like me or something of that nature. So congratulations to everyone that submitted. At least we really have something to work on. And those who didn't submit, I believe you learned something about how to write patient education article. Preventing accidents at home, keeping kids safe from falls, phones, and poison. This one looks like ebook. So how do I check all the fonts now? I won't be able to check. Let's just look at the content. I love the picture anyway. Highlights accidents that occur upon children, especially toddlers and adventurers. This accident are in various forms. Okay, the highlights look good. Content H1 overview. Was it on H1 when you had it on Google Docs?
No, no, no. I didn't. Yes, I didn't understand that. So it wasn't.
Okay. But at least you've understood now.
Yes, yes, it wasn't like that.
On Google Docs, you have what is called H1. Okay. So overview. So this overview should be H2 actually. Is the title that is H1. This overview should be H2. In every page, you should only have one H1. That's an SEO principle. Only one H1 per page. Then domestic accidents are harmful. Okay. You started with definition. You should have started it with one of those accidents. Imagine if you come back and you see your toddler inside whatever. That kind of statement. So, however, this is more common under fire that particularly vulnerable. The energy may be unmatched by that of the injury is the major cause. This accident, you see, I'm not really reviewing this, I'm just looking for obvious errors. You may not see the ones that are not obvious. Okay, the citation is according to the guideline. That is good. I can see something about a country in Dakar, Senegal, that makes it human. You are pointing to people within a particular country. These accidents come in two types: intentional and non-intentional. Okay. Non-intentional and preventable. Your health provider will assess. Okay, I also like how this place is. It's scanty, it's not dense, and the same thing with this place. Risk factors, age more common than large family size, insufficient, low parental education for adults. Then types of domestic accident: four, bonds. This one is your specialty. Chemical bonds, electrical bonds. Hey, this is good. Then cuts, poison. Okay, well, I'm just assuming that I'm that visitor that doesn't know anything about medicine. I think I can get some of the things you put here easily. Joking, but like I said, I've not looked at this with my binoculars. I'm just looking at it. Like, okay. Then the sequelae of domestic accident can range from simple injuries. Okay. One good thing about your work is that you made every effort to bring out the points as isolated points, easily readable. So your work is readable. That's that's one good thing. Although the pictures are so many anyway, but your work is readable. Then what is this primary preventive measures for domestic accidents in children? This can be okay. Okay, you subdivided them. Then under bonds, these are the preventive measures for scout bonds, plain bonds. It's as if you went to town with these bonds. We know you are a plastic surgeon. But the people you are writing to, they just want to know about all these accidents. They may not want to go deep into the different types of bonds. So, when you put up so much information, they get overwhelmed. So you should summarize these bonds, some of these points, so they don't get confused. Then you have false, you have cuts, poisoning, okay, choking, drowning. Then secondary prevention. Now this is good. So where is the primary prevention? I mentioned it before when I was reviewing. Now, most times, anytime you talk about prevention, always think of this: primary, secondary, tertiary. That should be the pattern whenever you talk of prevention of anything. Poisoning, secondary prevention. Okay, electrical work. Oh, this article is, I believe this is more than 2,000 words. I can't really check the wordings now. Conclusion. Okay, so let's look at the references. Key practice, managing injuries, taking appropriate action. Okay, so if it's for UNICEF, sometimes some people prefer that you write the organization's name before the hyperlink. Then this is Vancouver. Is it Vancouver? Yes, it looks like it. No, it's not Vancouver. This is APA style. This 2016 is not Vancouver style. And then this one looks like, so you have a mixture here. You have APA, you have Vancouver difference. Okay, 2015. This one is APA again. So harmonize your references. Let them be uniform. I didn't see your AI score and the journey. So whether to the extent to which AI contributed to this is what I can say. And even the plagiarism score we didn't see. But then the article, just by skimming through it, you say AI score, comma, question mark.
That
I,
AI, this thing, they were asking for payment. So they were asking that that AI checker, I could post only, is it 250 per time? So I was wondering how I will add everything at once. Add
sorry, I
everything.
to you do what you do for the free ones. Most of them take 1,000 words of 5,000 characters. So what you do is to divide the article into two, check the score, and down put the average score. It's even go through all those people that I reviewed the one. I didn't mention that. So I expected to see it should be the average score that you should have, average AI score, not just one score. Because if you have an article of more than 1,000 words, there's no way you'd have checked it with all those free softwares. So thanks for raising this. That's what you should do. Divide it into two, then get the average. That's how to use the free ones. Okay, the article is 1,670 words. Okay. So that's what you should do for the free version. So your article looks good, but it would have been good to see the AI score and plagiarism score. I love the pictures, although there are many. So you have to choose the best ones. So that's good. So